Hello all, welcome to another lecture on Incentive Spirometer. So let's see in detail about Incentive Spirometer. This is the Incentive Spirometer. It has got two parts. It's got red ball, yellow ball and blue ball. Here it is written as 600 cc per second, 900 cc per second and 1200 cc per second for blue ball. It has got mouthpiece. We will attach this one. And in this video we will see indications, contraindications, uses of spirometer, precautions while taking spirometer, and who has to do this incentive spirometer and how to use this spirometer. So first let's see what are all the indications of spirometer. So indications is in all pre-operative patients, pre-operative screening who are at risk of post-operative complications, patients who are unable to do this incentive spirometer, they may not be cleared for permission for surgery, and presence of atelectasis. Atelectasis means collapse, failure of any part of lung to expand or collapse of any bronchopulmonary segment in the lung. If any collapse, minor collapse are there, you can get rid of that collapse or atelectasis with this incentive spirometer. And conditions predisposing to atelectasis like any thoracic or abdominal surgery, patients who are having prolonged bed rest, and surgery in patients with COPD. And restrictive lung disease like patients who are having poliomyelitis and any other thoracic deformities, kyphoscoliosis, etc. Those sort of restrictive lung disease associated with diaphragmatic dysfunction or respiratory muscle weakness, they should do this incentive spirometer. And patients with inspiratory capacity less than 2.5 liters. Inspiratory capacity means inspiratory reserve volume plus tidal volume. When it is less than 2.5 liters, they should also improve their capacity with this incentive spirometer. And patients with neuromuscular disease or spinal cord injury, so these patients should do incentive spirometer. And apart from that, even normal healthy young individuals can do this incentive spirometer and can improve their lung function. And let's see what are the contraindications of incentive spirometer. So firstly, patients who cannot use the device appropriately, patients who are mentally not well, and non-compliant patients, pediatric patients, like very young patients who cannot understand the procedure, and patients with developmental delay, hyperventilation or fatigue, hypoxemia secondary to oxygen therapy. If patients who are on oxygen, when the oxygen is removed, the patients are becoming hypoxemic, there is no point of using this incentive spirometer. And heavily sedated or comatose patients in coma cannot do this spirometer. And device not suitable for patients with severe dyspnea. If patients are having severe dyspnea, it is not advisable for them to do this incentive spirometer. It's only for patients who are at risk of developing lung infections, patients who are planning to go for surgery, or patients who want to improve their lung function, they can do this incentive spirometer. So how this incentive spirometer work, I will explain. Basically, it prevents lung infections by expanding your lungs and strengthening your lungs by keeping your lungs inflated and clearing the mucus and other secretions from chest and lungs. So that's how it works. I'll explain how to do this. So first let's see. Exhale deeply and then inhale strongly so that all balls will rise, and try to keep those balls in the air as much as you can, and then release. So let's see how I will do. For this much time you cannot keep, but you can keep it for at least 4 to 5 seconds. And another way of doing it is like this. Take deep breath. Take deep breath and then blow. Try to keep the balls in the air as much as you can. So these are the two methods of doing incentive spirometer. And let's see what are the precautions while taking this incentive spirometer. So this technique is inappropriate as the sole treatment for major lung collapse or consolidation. If major lung collapse or consolidation is there, you have to treat that collapse. You have to remove the obstruction either by bronchoscopy or any other methods. Or if consolidation is there, this is not the treatment of choice. If consolidation is there, it needs to be treated with antibiotics and other supportive measures. And hyperventilation may result from improper technique. If you are not using it properly, hyperventilation may result. And there is potential for barotrauma in emphysematous lungs. In COPD lungs, patients are not supposed to do as much as they can, because if pressure builds up in your lungs, the small cysts or bullae which are already there in COPD lungs may rupture and form pneumothorax and cause barotrauma. So in those cases also, they need to be done cautiously, and close monitoring of patients with hyperreactive airways should be maintained. So these are the precautions. And then let's see how it helps the post-operative patient. So after surgery, an incentive spirometer can improve the lung ventilation, recover from anesthesia quickly, loosens mucus from the lungs. Deep inhalations help prevent mucus and fluids from building up in your lungs. So that's why it's very much helpful soon after surgery. So that's why all post-operative patients in surgical wards, they will give incentive spirometer, and it helps prevent the lung complications. Slow deep breaths fully inflate your lungs, which help clear any fluids that may cause lung conditions like pneumonia. And then finally, how to clean the incentive spirometer. It's a good idea to clean it daily. So detach the mouthpiece from the base of the device and then clean it with under clean running water. And then with antibacterial soap for about 20 seconds. Then wash the rest of the spirometer, this one, with water and soap. And make sure the spirometer is dry before you use it next time. So the more you use the spirometer, the strong your lungs will become. But it should be used with caution, particularly in COPD patients, because of potential barotrauma. So this is the simple video about incentive spirometer. Hope you like it. Thank you.